Hello everyone, I am Dr. Tahir and welcome back to Youthful Medicine. I'm a rheumatologist and an obesity medicine specialist and welcome back to my channel. On this channel, I focus on autoimmunity, obesity, and longevity medicine. Today, I will be talking about an important topic, osteoporosis, and long-term use of medication called Prolia, denosumab. Specifically, I'll be answering the question of how long a patient can safely stay on Prolia and what other treatments options are available if it is time to transition off of Prolia. Well, let's start with a case study. I saw a patient recently, it's a 68 years old female who has been on Prolia for about 6 years. She had a most recent DEXA scan done April of 2024, and the bone density scan showed that she had osteoporosis in the lumbar spine with a T-score of minus 2.8 and osteopenia in the femoral neck, the hip bone, with the neck of T-score of minus 2.2. So we have two regions that we are focusing on. The spine bones, vertebral bones, are most prone to fracture, but the most dreadful complication of osteoporosis is your hip fracture. So both of these numbers are here. Minus 2.8 means you are higher than what the osteoporosis range is. Your weakness is more than what osteopenia calls for. You are in osteoporosis range if the T-score is minus 2.5 or worse. So in this case, it's minus 2.8, so it's worse because it's a negative number. And the osteopenia in the femoral neck is in minus 2.2 because it's better than minus 2.5. And my patient has been on osteoporosis treatment with Prolia for about 6 years. So she have had about 12 shots of Prolia, which is given every 6 months under the skin. And she comes to our clinic. Now she's wondering how long she can safely continue taking Prolia and whether it is time to consider other treatment options. So Prolia, and how long is it safe? Well, Prolia is a medication that is typically administered every 6 months to help manage osteoporosis. The current data for the use of Prolia was initially released for 6 years, but now the data has extended and the safety range is up to 10 years. In most of my practice, I switch the patients or discuss about switching the medication in about total time duration about 10 years. So the effects of Prolia on your bones is to slow the bone loss. The bone loss is going on as we take the medication. The ongoing bone loss becomes much slower and there's a net positive effect of the bone. We monitor our patients through labs and through medical visits every 6 months for minimum and repeat bone density scan every 2 years based on the insurance approval process and Medicare requirements. So if the patient is tolerating the medication well and remains at a high risk of fracture, such as this case, where she is still osteoporotic, it may be appropriate to continue the medication. However, there are some concerns or side effects which are important to consider other options. Now, one of the complications of the osteoporosis is osteonecrosis of the jawbone, for which we always advise patients to make sure they have good dental hygiene. So what happens if we have to stop the Prolia? Well, one important thing to know about stopping the Prolia without transitioning it to another therapy, it can lead to actually rapid bone loss and even higher increased risk of fracture. So this makes it very crucial to have a plan in place if we decide to stop the Prolia. So I tell my patients that if you are not certain about how long you would like to continue the medication, we should have an exit strategy, a transition strategy for you. So what are the alternative treatment options? So bisphosphonates like pills such as Fosamax or alendronate is a good option, or intravenous medicine like Reclast or zoledronic acid help maintain bone density by slowing the bone loss. And they can be often used after I switch patients to Prolia. Other medications like anabolic agents such as terapeptide or Forteo or abaloparatide, which is Timlos, actively build new bone and are ideal for patients who have severe osteoporosis even if they have been on Prolia. So if you want to build somebody's bone because they have had fracture or they have poor healing of the bone after a surgery, these anabolic agents can be used. They are a little bit difficult for the insurance company's approval process, so you have to work with the physician office to get the prior authorization. Recently, we have also started talking about another medication called Evenity or Romosozumab, which is another bone-building medication. It is only administered for a short duration of time. We give 2 injections in the skin once a month for a total of 12 months. And the last option, which is not very popular and I am not currently using, but it is an option, is called selective estrogen receptor modulators or SERM, like raloxifene, Evista. They are sometimes used, but they are less effective. So it is essential to discuss these options with your healthcare provider to create the best treatment plan for you. So overall, beyond medication, just medication is not enough. In my practice, I'm always ensuring my patients are eating bone healthy nutrition, which I'll create another video at another time. Your nutrition is not only calcium and vitamin D, but there are many other things for your bone that you require. Weight-bearing exercises, reducing inflammation in your intestines, making sure you're taking probiotic-rich food to help the absorption of all minerals and nutrition that you require is also important. So managing osteoporosis is complex, but it is with a teamwork, with good intentions, you can get the best outcomes unique to your needs and circumstances. So this is the end of the video. Thank you for watching. If you found this helpful, please like this video, subscribe to my channel, and share it with others who might benefit. And don't forget that living a healthy and life with youth and vitality is within grasp. I like to say that continue to strive for a better health and you will achieve it. Until next time, thank you for watching.